Hi, my name is Rob Trujillo, and I work for Tooele County. And I wanted to share with you a little bit about my journey with diabetes. I found out I was a diabetic specifically because of my work. I have to have a CDL for work, and because I operate heavy equipment. And so part of that process is going to the doctor and having a physical. And the first time I went to get checked out at the doctors for my CDL, the doctor was just went crazy because my blood sugar was like at 400, and so that was my first experience of learning that I was a diabetic. We have a number of diabetics in my family. I have a sister who is a type 1 diabetic, and then I also have aunts and uncles. So we have within my immediate family and my extended family, we have quite a few diabetics. And so it was really odd, really odd, because I felt fine. And I think it's really hard for guys to go to the doctor and have to be able to face the reality that you are vulnerable. And so one of the ways that I have coped with having diabetes is realizing for me to be able to take care of my family, I have to take care of myself. And so it's been really important for me to maintain my blood sugars so that I can work and be healthy and feel good and be able to support my family and my kids. And when I found out I was a diabetic, I was really afraid that I wouldn't be able to have my CDL, and that would affect my ability to do my job. And for a lot of guys, their work is a big part of their identity. And so through a team effort, like with my physician and my employer and my family, with that support system, I've been able to be successful and have good control of my blood sugars. So diabetes is an expensive, is very expensive. You have a lot of testing supplies that you need to be able to, strips and readers and testing solutions, and then also methods of delivery, depending on how your medication is delivered, can be very expensive. I have good insurance, so I'm lucky that through my employment, a lot of my needs can be met. But there are those that would really struggle with being able to find adequate care. And so it's important that there are resources in our community here in Tooele County, where we are a rural community, where if someone is struggling with testing being able to access testing materials or even medications, that there be a means for them to get help.
What resources in Tooele County help you with your diabetes?
When I was first diagnosed, one of the things that I really appreciated was the diabetes class that I took, and it gave me some really good ideas, and it taught me a lot about portions. When I was eating like I was a 19-year-old and not like I'm a 37-year-old. And so it gave me a lot of awareness about the amount of food that I actually needed for my body as opposed to what I've always done. And so that helped me a great deal. And also it changed my perspective about what a healthy meal is. It didn't have to be like 6 pieces of pizza as opposed to 2 pieces of pizza, It gave me some perspective and some understanding about how to control my diet. Okay, usually in the morning, I always eat breakfast. I'll test first, but usually if I can control my blood sugars first thing in the morning, the rest of my day goes really a lot better. And so in the morning, I'll eat usually like a half a cup of oatmeal, and that usually fills me until like around 10 o'clock, and then I'll have a snack. And then depending on where my blood sugars are at noon, I portion out what I'm going to eat. I generally tend to eat a lot more protein as opposed to like high carbohydrate foods. I've found that helps control my blood sugars much better. And so usually like I'll check about 2 o'clock, check my blood sugars, and then depending on where I'm at, if I'm low, I'll have a snack about 3 o'clock in that time period. And then a snack for me generally is like unsweetened applesauce or popcorn, like a small bag of popcorn, something like that. And then dinner time with the family, I check my blood sugar before then, and I also take my medication before lunch and dinner, and that's an injection. And usually at dinner time, depending on where I'm at on my reading, controls like my portions and what I mean. And I generally eat the same things as the rest of the family, but I just I try to count the carbs and make sure that it's just not overboard. And then I usually check before I go to bed. So, but I haven't had a lot of lows, so I tend to go high to the opposite direction. So I have to watch a little bit closer. I feel like my future with diabetes is bright. I think that the work that is going into research and study of diabetes is very important. I'm excited when I hear about grant opportunities and funding, especially for rural communities. I think it's important to be able to bring services to people in outlying communities. Tualatin County is geographically the largest county in the state, and so it's important that I think that we need to have some sort of a more mobile service where we could reach out to like people, like Native people and Hispanic people who live in rural areas, because they have a higher propensity towards having diabetes because of their genetic makeup. So if we could formulate some sort of a mobile service where we travel to like the reservations or to some of the outlying communities and brought community education to them, I think that would impact our future. I think my future with diabetes, as long as I control my blood sugars, I think I'm going to be healthy. I worry about my feet and my hands. I'm a musician. I play the piano, guitar, and organ, and so being able to maintain my blood sugars and my health is important to me because I want to be able to have that musical expression. And so I watch my blood sugars for that reason, because I want to be able to not have a leg amputated or my feet or my fingers, because that can be a side effect of diabetes, of high blood sugars. And so that circulatory system is really important to be aware of and to take good care of. So, my name is Rob Trujillo, and we are the faces of diabetes. Together we are strong. Diabetes, face it now. It's not easy, but it's worth it.
All right.